So we're moving on now to Trinh Sia, who is going to be presenting on the physical activities for people with motor neuron disease. Thank you, Trinh.
Hi, my name is Trinh. I'm a physiotherapist working at a specialist MND clinic at Calvary Healthcare Bethlehem in Melbourne, Australia. In 2018, we did a joint study with Monash University looking at physical activity participation in people with MND, and we wanted to explore the option of using the PASE as a measuring tool in this population. And today I'll be sharing some of our findings with you. So, what do we know about physical activity participation in people with MND? Well, we suspect that participation is low, but exactly how low we don't know. Currently, there's no documented outcome measures to capture this in people with MND. And if people are doing something, what exactly are they choosing to do as the disease progresses? From observation, we know that participation reduces as disease progresses and as the function decline, but we don't know which function. Is it respiratory function or is it motor function that has the biggest impact on physical activities participation? And just like with the general public, participation varies widely between individuals, and we're wanting to explore some of the common factors that can influence physical activities participation in this population. So we did a literature review and looked at a number of different self-reported questionnaires measuring physical activity participation. And we decided on the PACE as a measuring tool, which I'll talk more about in a little bit later, and designed a study to try and answer some of these questions. You can see here are 4 research questions, which are really summaries of the gap in our knowledge that we just spoke about. Now, for those of you who are not familiar with the PACE, it's called the Physical Activity Scale for the Elderly, and it was designed specifically to measure activity participation in people over the age of 65. There are 13 items in all. The first item is excluded from the final score because it measures sedentary activity. And you can see in the table here the other 12 items. And next to it, you'll see the PACE weight, which is a weighting that's assigned to each of these activities based on the intensity of each of them. So to get a PACE score, you'd ask the participant to write down in the last 7 days how often they did each of these activities and how long they'd spent doing each of these activities. And you use a formula which combines the PACE weight, the frequency, and the length of time to calculate a final score, which ranges between 0 to about 400. So why did we choose this tool? We looked at a number of different outcome measures to measure physical activity participation, and this was a standout for us for a number of reasons. First, it's quick and easy to do. The author suggests that it takes about 5 minutes. In our experience, it took more about 10 minutes. And this may be because it's the first time we're doing it with each participant and there was a little bit of explaining about the tool to each of them. It has been tested in various populations and mostly it came out to be well validated. It came with a very detailed manual to explain how to calculate the score, and it has in it a very comprehensive list of what is considered light, moderate and strenuous sport, which makes it easy to categorize the activity participants report. The standout feature of this PACE, though, is that the questions covers different domains. It covers work, paid or volunteer, housework, as well as leisure time activity. Most of the other outcome measure focuses more on leisure time activities. So our study is a prospective observational study design. In a 4-month period between July to October 2018, 190 patients were seen by physios at the clinic. These patients were screened and 100 patients were recruited into the study. Now, we decided to exclude the non-ambulant patients as we believe this would skew the data. So we collected data from the 100 ambulant patients. These data include the PACE score, the ALSFRS, as this is a current gold standard in measuring physical function in people with MND. FVC to measure lung function, a bunch of demographic data such as age and gender, phenotype, and gait status, including the gait aid needed and the level of assistance, and for history in the last 6 months. We also broke down the ALSFRS score into the sub scores to analyze the data. So here you see a snapshot of our participant characteristics, and I just want to point out a few things. First of all, the mean ALS-FRS score was 33, and this represents someone who is moderately affected by the ALS. Secondly, about 76% of our participants exercises regularly before diagnosis, and we think that this represents a fairly active group at baseline. And lastly, we only had 100 participants. However, the characteristics is very similar to that from a much larger study. Paul Tubman et al. In 2016 did a study with 1,700 subjects recruited across the 10 major MND clinics in Australia, and he had a very similar gender distribution, mean age at onset, and also the phenotype distribution was similar. And this gives us confidence that our study results can be generalized across the population. So here are our results. We found that the PASE can be used to measure physical activity participation in people with MND. The total PASE score correlates well with the ALS-FRS score, which is the current gold standard in measuring physical function in people with MND. Now, when we look at the subscores, we found that PASE score has the largest correlation with the fine motor subscores, followed by the gross motor subscores. This was a bit surprising for us, but if you think about it, it makes sense. Most, or if not all, of the physical activity that we do, such as gardening, housework, sports, all involves the hands and fine motor function. And this suggests to us that perhaps people with motor neuron disease start to slow down as their hand function decline and they can't manipulate things anymore, even while they still have reasonable gross motor skills. And the last thing I wanted to point out on this page is the correlation between PACE and FVC. We see here that it is significant, but it's relatively small compared to the other outcome measures that we looked at. This suggests that perhaps respiratory function is not an important factor in voluntary physical activity participation in this population. So our study results shows that physical activity participation in people with MND is in fact very low. You can see here the maximum PACE score is about 400. Normative data for men aged between 65 to 69 was 144, and women of the same age group was 112. Our cohort mean PACE score was only 52. Now, these normative data were taken from the original paper, which was published back in 1991. There's no more recent normative data published, but a recent study done by Mantri et al. In 2018, which looked at using the PACE to measure activity in people with early Parkinson's disease, comparing that with healthy controls. And they reported the PACE score for their healthy controls to be around 200, which is significantly higher than the ones we've got here. We then performed standard multiple regression modeling to see how the different variable influences physical activity participation as measured by the PACE. You can see in the first column a list of all the different data points that we collected, and the value of interest is the R-squared value. So down here, R-squared is 0.25, and what that's telling you is that when you combine all the different data points that we collected, that is the ALS-FRS total, the FVC, the age, the gender, the disease duration, and the gait status, that explains 25% of the variability in the PACE scores that we observed. So breaking those down into individual R-squared values, you can see that ALS-FRS explained about 18% of the variability in PACE, with the rest of it contributing very little. Now, for those of you who were observant and remembered, we also collected false history, and it's not here. We didn't actually forget about it. The fact is, our statisticians have looked at it in many different ways, and there is actually no correlation whatsoever between false history and PACE scores. As part of the PACE, participants were asked to write down the activities they were doing in the 12 different items. We extracted this and categorized them, presented them here in percentage. So you'll see that the most common response was walking around outside their home. About 71% of our participants reported to have done this in the last 7 days. The second most common response was housework, and whether this is by choice or by necessity, we don't know. The top 4 responses you can see here are all activities done around the home, with only 12% reporting that they've done some kind of sports in the last 7 days, and even less than that, only 10% did an exercise group in the last 7 days. So after completing the PASE, participants were presented with 2 extra questions around barriers and motivators to exercise participations. They were presented with multiple choice options to choose from. So in terms of barriers, 61% of participants report that fatigue was the main factor why they're not doing any more exercise. And the other thing I wanted to point out here is that only 6% of our cohort reported that there were no barriers, meaning 94% of people we interviewed were wanting to do more, but they couldn't for one reason or another. And when it comes to motivations, personal enjoyment was by far the most powerful motivators. And disappointingly, only 8% reported that they were doing exercises because the physiotherapist have asked them to. So in summary, our studies showed that physical activity participation as measured by the PASE is very low, and it is most strongly influenced by disease severity as measured by the ALS-FRS. It correlates well with the fine motor and the gross motor subscores of the ALS-FRS, and the correlation between PASE score and FVC is small yet significant. We found that walking outside the home is the most common activity of choice for people with MND, and our participant reports that fatigue is the biggest barrier to participation, while personal enjoyment of exercise is the most powerful motivator. Now, there's a couple of limitations with the PASE that I just want to highlight. First of all, it's a self-reported questionnaire, and as with all self-reported questionnaire, there's a tendency for people to overestimate their level of participation. In fact, the study Matri et al. 2018 that we spoke about earlier, looking at people with early Parkinson's versus healthy controls, found that some of their participants were reporting more than 24 hours worth of activities in a day. And those are the ones that you could easily pick out. The other ones that we're reporting less than 24 hours of activity, it's a bit harder to tell whether it's a true reflection or not. And that's one of the reasons why the first item of the PASE was included. So to give you a snapshot of a whole day, so you can sort of gauge if they're overestimating or not. The second point is that the PASE does not include walking within the home. So the walking item only counts the walking that was done outside their home. And this obviously creates a flow effect. So for someone who is not going out, who's not doing any sports and not doing homework, housework, but they're still walking to the toilet, they're still walking around inside their home, they will still score a 0, which is the same score as someone who's bedbound would. And lastly, this study was done in a 4-month period over July to October, and in Australia that represents late winter coming into spring, and there may be some environmental influence on the amount of physical activities people were doing in that period. I can imagine if we were doing it in the dead of winter, we might get a much lower mean PASE score, and conversely, if we did it later, we might get a higher mean PASE score for our population. So what does this all mean for you? Look, we believe that our results show that the PASE is a quick and easy tool that can be used in people with MND. And as the PASE doesn't include a walking within the home, we'd recommend that you combine the PASE with a household ambulatory scale to get a fuller picture and increase its value to detect change in this population. And lastly, the most popular physical activity of choice for people with MND is based around the home. We think this is an important factor to consider when designing an exercise program to maximize compliance and minimize fatigue. Here's a few of my references. So thanks for tuning in and listening to me. If you have any questions or comments about anything you've heard, I'd love to hear from you.
So Trinh, thank you very much for that. That was really, really interesting and very practical and helpful. I'm just going to see if there are any questions for you. And how can this help? Let me just have a look at this chat. And it says, how can this help mapping how we can move? And can you recommend we move as much as possible?
Sorry, can I just clarify? Is that from someone who has MND as
Gudrun, yes.
Yeah. Look, I think there is a lack of understanding about what exercise and how much exercise, and that's what triggered this study in the first place. We recognize that there are lots of things that are, I guess, influence how much you do, and primarily fatigue is the biggest issue we see in people through our clinic. So I wouldn't want to prescribe you exercise, which would make you too tired to do the other things that you would want to do. So I think it's always a fine balance between, you know, do I exercise or do I spend time with my family, for example, that kind of thing. So what I guess I'm hoping to do, and I think what's more important, is divide the population of people with MND up. I think exercise will have different benefits for different groups in this population. So that's what needs to, we need to find that out. And the other thing I'd like to find out is if we encourage more exercise in the certain groups, does that change how the disease progresses? And at the moment, we really don't know that yet. So yeah, unfortunately, I don't really have a good answer for that. And then I think that's why, you know, the motivator to exercise is interesting, because people are doing things that they want to do. They don't have much energy. Yeah. They want to spend that doing what they enjoy rather than, you know, a set of weights or something.
Yeah, no, anybody can be put off by weights, I think.
Yeah.
Another question is, was mental health taken into consideration with the activity level and motivation, etc.?
No, not formally. I did track those that have a diagnosis of FTD, or some of the people might need assistance from their support person, so their carers to complete the questionnaire. But no, we didn't formally track that, and I think that's something we should, you know, in future studies.
Thank you. You've also got a lot of comments about how interesting it is, and thanking you, and a very useful presentation. I have a question in that, just wondering, you mentioned how difficult it was to calculate the score of the tool. Do you think that would outweigh how people use it if it's hard to calculate?
So when we looked at the different tools, this is actually one of the easier ones to calculate. There is a, I guess, complicated formula, but the manual that comes with the tool explains it very well. And if you set up the formula once, it sort of automatically calculates for you as you input the data. So it's sort of a once-off pain kind of thing.
Yeah, that's good. Thank you. And Amber Ward is asking, is thinking about COVID, and has that changed the things in this particular area?
Yes, I think it definitely would. So this study was done pre-COVID, and my plan was to do the second phase of the study around now, but we sort of postponed that because of COVID, because I think definitely a lot of people are not leaving their home, especially in Victoria. We had quite a rigid lockdown recently, so I think definitely it would have.
I just have a final question, I think, at the moment, is from Sarah, and she's asking, was there a particular reason for not including people who are non-ambulatory?
So that was a decision made. We felt like if we had included the non-ambulatory group, it would skew the data towards the lower end of the scale. Look, and I think you're right in that I think we should look at the non-ambulatory group as well, because there are physical activities that these people can do. However, when we looked at our sample, the people that come through clinic, most of people who are wheelchair bound are not doing as much, just from an observational point of view. So we sort of excluded them for that reason.
Lovely. Thank you so much. I don't think there are any more questions. We'll wait just 1 second to see if there's any more. No, but I do think you have a lot of comments for, thank you, great job and well done, it says on the chat. So thank you very much, Trinh. Thank you.
Thank you.